Joel Topf here with Nephrology Times, and I've got Dr. Robert Montgomery, who won the Excellence in Transplantation Award. Thank you very much for joining us.
Thanks, Joel. It's
Excellent.
nice to be here.
I was reading your bio, and it starts off that you were in the Guinness Book of World Records for the most transplants in a day. How many of those transplants did you actually do?
Well, I scrubbed in on all of them.
All 10?
All 10. But,
that's a day.
But, you know, there were other surgeons who were working
I would hope
on.
so.
Yeah.
That's
yeah.
pretty
It's
amazing.
the only thing that my kids are impressed with.
If I were, of course, it's amazing, right? That's awesome. And then the other thing that struck me is that you are a transplant, you have a kidney, heart transplant.
Heart transplant, yeah.
That's
I'm a
amazing.
recipient. Yeah.
And do you talk to patients about your experience? Does that
Of course, yeah, heck yeah. Yeah, when we talk about immunosuppression, the side effects, how different drugs feel, what they should expect, yeah.
That's
awesome.
Awesome.
All my patients know that I've had a transplant, so.
Very cool,
In fact,
very cool.
when they sit down and get their education, I'm in the video that they all watch, so.
Awesome, that is very cool. Congratulations on getting the heart. I mean,
oh my gosh,
amazing.
yeah, I beat the odds.
Yeah. How's Lisa doing?
She's good. Yeah. She's now 5 weeks out from the kidney. Yeah, and
then
another, 6 weeks.
Another week or two on top of that for the
heart.
LVAD.
Yeah.
And you know, it's funny. Her story kind of exemplifies what the promise of these pig kidneys are.
Yeah.
Is that she had already been denied a kidney transplant because of her heart.
Right.
And because of her kidney, she wasn't going to be able to get an LVAD.
Exactly.
Right? This technology allowed you to untie that knot.
That's right.
That's,
yeah. And there'll be many other things like that, I'm sure. And I think some of these organs are going to be used as a bridge to transplantation too. Some will be destination therapy. So. It's going to be very interesting as this sort of rolls out and we understand the place that pig kidneys are going to take in this whole scheme of things. Yeah.
When you think about xenotransplantation, what are the things that you're worried about? Is it infection? Is it what is it? What are the things that you are concerned about?
I mean, I think that we still don't fully understand the immunobiology of the human response to a pig organ. Mm-hmm. And the reason I say that is, up until very recently, all the research work that had been done in primates receiving pig organs that had been engineered for humans. So
Gotcha.
like
Okay.
a surrogate third party.
Right.
And so how translatable the information that we've been able to get from the primate work is going to be to humans, I think is an open question.
And this is what you're going to be discovering.
And that's what we're working on, yeah.
So one of the things that I was looking at in a KI report that looked at the UAB experience, they talked about kind of essentially a diabetes insipidus-like picture that the pig kidney didn't recognize human vasopressin. Are you seeing that in your patients?
No. In fact, we demonstrated, in the decedent model, a longer decedent model.
Yep.
So the work that you're talking about, UAB did, it was a 7-day experiment.
Yeah, that's right.
And we then did a 2-month study. And it clearly that, after a period of time, after this big diuresis that happens, that's part of diabetes insipidus, using vasopressin, the kidney will respond to it. Yeah.
To human vasopressin.
To human vasopressin. Now, it doesn't appear to make renin, but and doesn't appear to make epogen, but the blood pressure's been fine, and Lisa's situation is
Clearly
unusual
complex,
because it's an LVAD, but with the 2-month decedent, the blood pressures were very steady throughout the 2-month period.
So are you running into any weird homeostasis problems that you're like, because a pig does different things than a human in that regard?
The physiology we really worked out in the 2-month decedent, so we kind of knew what we had to do and what we had to replace and what we didn't have to replace. It can do most things, but not all things. I just mentioned one or two that it doesn't. As far as the response, though, of the human immune system to the pig kidney, it seems to be really different. So in the biopsies that we've done, in the immunohistology, in the multi-omics, all these studies that we've done. It's a different map. It looks very different. So we have a couple of papers now on that 2-month decedent that are going through peer review. But I think when they get out there and people look at them, you'll see that it's a really different response that looks as different as Earth to Mars. So there's a lot to learn. Now we had a rejection episode after 1 month in the 2-month decedent.
Yep.
We were able to manage it using standard immunosuppression. So that's the good news. So even though it doesn't look exactly, it doesn't look that much like the allo response, it still responds to the drugs that you would think would work, and plasmapheresis and interventions like that.
I'm just a grunt nephrologist seeing patients in the trenches, and I can't tell you how much excitement there is among my patients.
Yeah.
They are all following this.
Yeah.
To them, it is just a huge signal of hope.
Exactly, because when you think about it, we've somehow socialized ourselves into thinking that it's okay for only 3% of the patients who have end-stage renal disease to get transplanted every year. And the paradigm that somebody has to die in order to make that happen. I mean, it's kind of crazy when you think about it. So, that's what this is about. This is finding another source of organs that's renewable, that's sustainable, that's unlimited. Yeah.
Yeah. And it's going to be amazing for patients. So the question they always ask me, I'm going to turn it to you, is like, how long until this is ordinary, that this is not in the newspaper?
So, I think we'll be starting clinical trials in 2025. They'll be small.
With an aim to get it approved.
With phase 1, phase 2 safety trials.
Starting in 2025.
Yeah. And then, within probably 2 years, we'll probably be, pivoting into a phase 3 trial. So I would say my best guess is that within 10 years it'll be a common thing.
And have you been in those conversations with the FDA?
Sure.
And I don't even know what do you think a phase 3 outcome is going to be? Is it 1 year survival?
Yeah, I think.
Sense of that?
I think we're going to get a better sense of that from the phase 1, phase 2.
Okay.
We'll get a bit of a sense of the efficacy and how long these organs are going to last. These one-off, compassionate use.
Yep.
Type of INDs, I don't think they're going to inform us that much because, the patients are so sick that there's a lot of other things other than, the pig kidney that we're contending with. So,
that sounds like it.
Yeah. So I think, once we start the early phase trial, it'll be much clearer.
Outstanding.
Yeah.
Hey, thank you for this. This
Sure,
is great.
pleasure. Yeah.
Congratulations on the award.
Thank you.